Did you know that there's much more to gout than just the attacks? Gout is a type of inflammatory arthritis, which usually starts with bouts of severe swelling, redness, and pain at the big toe, but can affect any joint or multiple joints at the same time. People with gout experience flare-ups, known as gout attacks, which can be extremely painful and disruptive. But there's more to gout than just the attacks. Gout starts with too much uric acid in your blood. A high level of uric acid leads to uric acid crystals forming in and around your joints. These crystals continue to build up as long as there's too much uric acid in your blood. This buildup happens quietly over a long time. So far, this is all part of gout, the disease, which you might not even feel yet. The crystals already in and around the joints are the cause of gout attacks. Between gout attacks, crystals continue to form and are at risk of causing more gout attacks. Let's take a closer look now at what happens in the body during a gout attack. Gout attacks occur when the uric acid crystals get disturbed, causing a really sudden flare-up of pain and swelling in the joint. These disturbed crystals activate your immune system, which is your body's defense system. Immune cells try to attack the crystals, but since they can't break them down, they just end up increasing inflammation, swelling, and pain. After a while, your immune cells give up and move on, ending the painful gout attack. But uric acid crystals remain in your body between the attacks and might get disturbed again, starting another gout attack. So, where does the uric acid come from in the first place? Your body produces uric acid when breaking down old cells, which is a normal process. Uric acid can also come from certain foods and drinks. Normally, the amount of uric acid entering your body equals the amount exiting your body, which keeps the level of uric acid stable. If you have a high uric acid level, it's most likely caused by your kidneys not getting rid of the uric acid as well as they should. This could be due to a number of reasons. You might have been born with kidneys that don't get rid of the uric acid as well as others. This is probably the most common cause and the biggest factor in developing high uric acid levels. You might develop kidney disease later in life that makes your kidneys less effective. Or you might start a medication that interferes with your kidney's ability to get rid of uric acid. If your uric acid levels stay below 6 milligrams per deciliter in your blood, then uric acid crystals cannot form. But if the level rises and stays above 6 milligrams per deciliter, you will start making uric acid crystals. The higher the level of uric acid, the more likely crystals will form. But if you can lower your uric acid level and keep it below 6 milligrams per deciliter, the crystals will start to dissolve. And when there are no more crystals present in your body, you will no longer have gout attacks. Diagnosing and treating gout can be straightforward, but for many people, it's still not being treated as well as it could be. Treatment of gout attacks often includes medications that reduce the pain and inflammation, but these treatments don't lower uric acid or get rid of the crystals, so they don't cure gout, the disease, and don't prevent future attacks. But there are medications that cure gout, the disease itself, which work by lowering the uric acid level in your body and dissolve all the crystals. In some people, treating gout, the disease, can unfortunately make gout symptoms worse before they get better. It might be weeks or even months before you notice an improvement. But these medications are very effective when taken regularly. Therefore, alongside treating the symptoms of the gout attacks, it's very important to treat gout, the disease itself, as this is the only effective way to prevent further attacks.